So I'm going to start, and we're just going to go back and forth. We'll make this fun and light, so bring that energy while we're doing this. So definitely I'll count on all of your little smiles and laughs as we go along. All right, so you really, I think you already got a great introduction, but do you want to give a little bit more insight into the kind of work that you do for the center?
Sure, it's part of the program. Happy to. My name's Ryan. I'm with the Center for Practical Bioethics. I work with the ethics services. I find my work incredibly rewarding for one, being able to actually do something that actually has a meaningful impact. I was having an existential crisis recently, and I was talking to my wife about it, about what's the nature of work? What's the nature of reason of why we're here? What are we trying to do? Are we trying to leave a lasting impact? Thinking about wanting your name to live through the times, and why do we do what we do? And she was kind of getting frustrated with me, and she said, why are you even thinking about this? You have one of the most amazing opportunities, one of the most amazing jobs to do that. You help people every day. You leave a lasting impact. You're writing, you're thinking, you're actually maybe changing the world and doing all those things that you're trying to want to accomplish. So stop having this existential crisis. Realize the baby's diaper needs changed, and we need to go into the community days event. But that's really, it's wonderful to be able to go home, see our families, and know that the work that we're doing is actually having an impact. Not just an impact in our everyday, but our impact for the long term. I studied philosophy. I always found that as my passion. And when I was originally studying, I was an epistemologist, a philosopher of language. I just wanted to kind of live in the ivory tower and think deep things. But then I was exposed to medical ethics. I was told during one of my classes, I was told about a case, and that immediately changed my life. I changed my focus, I changed everything. I said, that is what I want to do, because there's one thing to be thinking these thoughts and trying to come up with what is reason, what is knowledge, what is the things that we're trying to do, but to be able to go into a patient's room, working with a family, helping a physician who are in a situation that is life and death, emotionally impactful, and incredibly challenging for everyone involved, and being able to actually help that situation, to take everything that we're doing and everything that we're working and all those hours of study and actually put it into the world and hopefully have a positive impact. There's nothing else in the world that I can think is more meaningful than that. So since I learned about that, I've done nothing but medical ethics. I've traveled all across this country with different positions, and I'm here in Kansas City where I want to be, and love being part of the Center for Practical Bioethics, and love the opportunity that this organization is in, that we are able to be a freestanding center. We are not tied down to an individual hospital. We're not tied down to an individual community. We're not even now tied down to an individual region of the United States. We cover hospitals all across this country. I have no idea what my tomorrow is going to bring, what situation it's going to be, what patient it's going to be, what hospital is going to be. And being able to have that impact and be in a position to have that impact on such a large scale and be able to touch so many people and so many lives and not be restricted is the greatest opportunity, I think, for this work, to make this as diverse, as universal, and spread this work as much as possible that the center is able to do.
Yeah, that's great. So I think you talked a lot about the value of the work that you do and what you also get. So for the people in the room that might not know what medical ethics is, what is it and why is it important?
I'm a philosopher, sorry. What is this? I'm just thinking of all these words. I would say the best way to describe it would be like a case example. I like to use cases when I teach, and it really kind of drives it home. We had a patient, he was in his late teens, and he had severe autism. And he is non-communicative, he hasn't been able to speak, and he was also refusing to eat and drink his entire life. He had nothing orally since he was 3 years old. And he came to the hospital. Mom, a couple years back, he had gotten a surgically implanted feeding tube right into his stomach, and he rips it out. And he just kept ripping it out and ripping it out. And last year, Mom brought him back to the hospital 40 times to have it surgically reinserted. And at this point, Mom brings him, she drops him off, and then she leaves. And then the medical team is looking at us and saying, we have two options here. One is we could do chemical and physical restraints. We could tie him to the bed, replace that feeding tube, and have that be his life for the foreseeable future. And the alternative would be to not place it, go comfort measures, and allow him to naturally pass. And I believe he was 16 years old when we're discussing this. What's the right solution here? And there's not really a lot of alternatives. It's kind of A or B, and both of those are just incredibly challenging. And mom is challenging, patient's challenging, team is challenging, and managing all these different competing interests, values, and trying to help support of what is, quote unquote, the right thing to do here is very, very difficult. So being able to get involved in this situation, add some guidance, add some clarity, and really support the patient, support the family, support the organization, manage those competing ideas to come to a decision that maybe not everyone thinks is perfect, but one that we can feel supported of as a direction moving forward.
That's great. Thank you.
Thank you. Now, could you, same question, can you tell me about yourself?
Yeah. So I am a social scientist by training, but I've spent most of my career as a clinical researcher. I spent a lot of my time actually at a healthcare IT vendor, which is now Oracle. And I was what we call now a data scientist. That's not what we called ourselves when I first started working there, but that's what we call it now. And I landed there by accident. I actually worked in the disability field for a long time. I actually worked at a large family service center, Operation Breakthrough, which is just down the road here, and learned a lot about what it looks like to create community partnership and what it means to bring complex work into communities and have challenging conversations to produce successful outcomes. And by success, I mean thinking about the work that is not only needed for people themselves to be successful in everyday life, but also to think about how systems can work to benefit them. So I was really kind of deep into autism research, really working with a lot of great colleagues at the University of Kansas, and I landed in the healthcare technology field just because the job description said researcher. And I was really excited about working with big data. So I spent a lot of time working to create clinical decision support tools. And those are a lot of the work that I talk about and touch and interact with the companies that build them today. So I got a lot of boots on the ground experience doing that work. And then I just saw a lot of things that I wasn't excited about, a lot of conversations and just a lot of challenges that everyone was having in thinking about big data and thinking about how we would use tools, especially in healthcare. And that concern is still alive and well today, but that really is what brought me to the center. So I'm really fortunate to lead the Ethical AI initiative here at the center and to grow what that looks like in our community.
So going off that, with your expertise, what coming technologies should we be excited for? Should we be concerned about? What's coming up?
So many things. I actually think that we are in a really great place of thinking about the risk and the benefit of AI tools in our society. So we've been living with a lot of AI, artificial intelligence, augmented intelligence is probably a better term to think about how it interacts with the human. But we actually have a lot of tools today that we use. Probably everyone has them in their bag, in their pocket. You might have used an AI-enabled tool to get here because you've never been here before. You've also probably used them in your home. I rely on my Alexa to help me with my grocery shopping. I have dance parties with my daughter on it. So I think that there's a lot of exciting things about this level of technology, not only for entertainment purposes, even though there's a lot of challenges that are kind of coming up with that right now, But I think there's also, there's so many limitations to the way that people interact with society. So there's physical limitations. There are things that people just can't even navigate safely, and I think technology could actually help with that. We've already seen technology completely transform artificial limbs. We've seen a lot of neurological advancement because of advanced technology. I think that we also, just even thinking about some of the things that came out of the pandemic around having things delivered to your house really fast. I now rely on groceries being delivered to my house. So there's so many tools that kind of can help with that. So I'm really excited about how we can think about using these tools to enhance our lives. And I think there's so many examples of how to do that. And I think that, we've seen a lot of those things in the consumer space or as individuals, but I think there's also a ton of professional ways that we can use them. So I am excited about some of the things that we can do in imaging. We've actually seen AI produce a lot of benefit in healthcare related imaging. I think we've also seen things that even with diagnostics, we have a lot of room to grow in that space, but we have seen some advancements in diagnostics. So I'm really excited kind of to see where that goes. I think the other part of it is sort of the things that are concerning, which may be a long laundry list. But I think that what is most concerning to me, it's not necessarily the products themselves. I think that we just continue to move at a rapid pace without a lot of guidance or consideration of what we might need to do every step in the development phases, right? So I'm more concerned about things just sort of getting out there that say, hey, we do AI, buy this thing. So I'm probably more concerned about that generally, but I think that we also, I think the other concern that probably is a larger umbrella as well is thinking about how we take those tools that we don't really know that much about and how do we put in those systems, because maybe we don't already have them in our organizations, or we don't know as individuals what questions to ask. So I think that we still have a long road, but I think that overall, I think I'm a little bit concerned that maybe we're not taking time to ask questions.
One more follow-up on that. You used the word AI, and you said artificial intelligence and augmented intelligence. What is AI?
Yeah, so AI is really a tool that uses large amounts of information and that it creates patterns and it produces kind of an output or something that you can use, a decision. And it uses really technical tools, but mainly it uses what people may have heard of the term machine learning. And tools that are kind of associated with that. A lot of really complex statistics are inside of that, some of which are very easily discoverable, and you can kind of understand the math. And then other ones are really complicated and kind of fold in and fold out on themselves. So that's where, the more that you kind of put in, the more that it learns, which can be a great benefit. But also comes with risk.
Thank you.
Yeah. All right. So, Ryan, what are some of the most challenging scenarios that you've encountered, and how did you work to kind of help the situation?
Well, every situation I've ever encountered is to some extent challenging, because I kind of joke about it. If the answer was easy, they wouldn't be asking the ethicist to get involved. So clearly there is some necessity for guidance. I would say some of the most challenging ones is when there's conflict within the family, conflict within the medical team, and there's competing interests, there's competing desire. I can remember there was a situation where a patient was multi-system organ failure. She had, kidneys were shutting down, lungs were shutting down. She was on the vent. The nephrologist came in and said, we could continue to do dialysis, but we would have to do continuous dialysis. And then if we do continuous dialysis, we'd have to prop the patient up. She'd have to sit up in the bed, and And pulmonology said, if you do that, her lungs are going to instantly collapse. So we're kind of between a rock and a hard place. Likelihood of survivability is probably about 5 days. And family were saying, do everything, do everything, do everything. She recently had surgery, and she was actually leaking bile into her chest cavity and then had sutures, and it was coming out of her chest cavity.
People just say lunch, right?
Sorry. You used to this? So, it's going to get worse. I'm sorry. Please finish your drinks and food. Okay, so back to her leaking bile into her chest cavity. The family are saying we have to do everything. When her heart stops, do aggressive measures. The medical team is saying this is non-beneficial, this is futile, if this isn't going to work. So after a couple days of conflict, of fighting, I was asked to get involved. I sit down with the family and I just talk to them. And if you know my background, I like words, I like language, I like what does it mean? Whenever I talk to a patient, whenever I talk to a family, I think a couple sentences in my head of what am I saying? What do I mean whenever I say this? And what is the person I'm saying it to going to hear? So I'm thinking about that of how am I communicating to this family? And we sit with them and I say, what are you looking to accomplish? Why is this not acceptable? Why is her death not acceptable? And they were saying, it was a Monday or a Tuesday, they said, well, Sunday is Mother's Day. And we want to celebrate one more Mother's Day with her. And I was honest, and I said, I don't think we can make it till Sunday. Just even if we do everything, I just don't think that's realistic. But Mother's Day is kind of an artificial holiday. Why does it have to be Sunday? And right then her son looked at me and said, you know what, you're right. Tomorrow can be Mother's Day. Any day can be Mother's Day. Can we do a withdrawal of aggressive measures in a couple days? I said, absolutely. So the next day, they had, this was during COVID, so they had like a train of family coming in 2 at a time. The waiting room was filled, and they all got to spend their time with her. They all got to sit there with her and say their goodbyes, and they made that day as great of a Mother's Day as possible, and then they removed aggressive measures, and she had a very peaceful passing. I feel that without our involvement, there would have continued to be conflict. She would have eventually passed. She would have eventually coded. The medical team would have had to do aggressive measures and resuscitation, and that would have been traumatizing for the patient, for the family, and the healthcare team. And our involvement, our ability to take a step back, to look at the situation, and to ask things in ways that patients may not be used to hearing them asked. Open questions. I also remember, if you've met me, you've heard me give this example many times because it's one of the most powerful cases I've ever worked on. Kind of the same situation, patient's declining, I was told it was futile, and I do my work, I get involved, and I ask the attending physician, has anyone said that this patient is dying? And they said, yes, we've said that. And I looked, I said, no, you haven't. You said, extremely poor prognosis, highly unlikely to return to baseline, no expectation of meaningful recovery. I know what that means. That family does not know what that means. So let's go in there and let's say that. Let's say she is dying. And they didn't want to do that. The doctor said, why don't you go in there and say that? And I said, we can go in together, I'll help support. So we go in there and we say, she is dying. There's nothing more really that we can do. We can do 3 days if we do everything, and probably about 3 days if we just prioritize comfort. What do you want to do? And the family took a breath and they said, we didn't realize that's where we were. We thought that she's come to the hospital so many times, so many years, we thought this was just another one of those, and we thought we're going to be fine and we'll just go home. We didn't realize this was it. So let's go comfort measures, and we changed the code stats after a 15-minute conversation. When I teach medical ethics, when I think about this, was there an ethical dilemma there? No, there wasn't. The family were on board, the family knew what they wanted to do what's best for the patient, the team was on board, everyone was exactly in line with what they thought was right and wrong. It's just there's a gap in that communication, there's a gap in that conversation. So being able to be involved in that scenario, be able to look at it from my ethicist eyes, my ethicist perspective, and say, have you said it in this way? Have you thought about it in this manner, in a way that the family would understand? When you say to them, poor prognosis, they think, well, that's what they always say. Not expected to return to baseline. Well, she's dying, it's a long process, she's in her 80s, of course she's not going to return to being in her 20s. But having that ability to work with both family and medical team to get these recommendations that people can feel supported of really do, I think, makes the work very meaningful.
What a powerful example.
Thank you. I have a question. Can you give some examples in medicine where AI needs ethical guidance?
Yeah. This is actually, this question has been kind of a part of our journey since we started the work here at the center in 2018. When we first kind of asked the question to our healthcare organizations, and to our partners, and even to the community that's working in healthcare IT, it was really, in 2018, people were like, well, AI, that's probably okay. We're using technology today. We have an electronic health record. It wouldn't be bad to just maybe put something on top of that to help us with decisions. I don't really see a problem. But then as, we have seen through kind of the COVID pandemic and some things that have come with that, we have really been a part of conversations where people are actually asking this question of themselves and of their organizations. And they really are asking, where do I have to think about this? And our answer is everywhere. Because these tools really are not just, used inside of a heart monitor or things that you might think of in a device, or you put something in to a CT or an MRI, or you're trying to solve some complex diagnosis. That's not where these tools are completely embedded. They're used in being able to decide whether someone gets a bed in an ED, whether someone gets a phone call for a follow-up appointment, whether someone gets pre-authorization for the service that they need for a surgery. All of these AI tools are embedded in almost every decision along the way, whether it's operational, whether it's clinical, whether it's administrative. All of these things are really important to start having ethical conversations. And also, when I think of where, I don't just think of who needs to be a part of the conversation. So I don't just think about the technical people that can understand and solve for these problems, because that is actually where we have been putting a lot of weight, is with the data scientists, the engineers, the people who kind of understand. We've hired people like chief technology officers, chief data officers, in a similar way that we hired CMIOs, CNOs, CNIOs. I mean, we can keep adding to the C-suite across healthcare organizations. And I actually think that the conversations about ethics and sort of the implications of AI across organizations actually need to start with the people at that level, and then also need to be embedded with community conversation to understand the impact of the decisions that are made at the top and how they impact the whole entire organization and the people that they serve. So I gave some examples, kind of on those, the pieces that are sort of embedded across a healthcare organization. But I think that having the conversation around ethics, being able to have a real conversation about what's just, what's fair, how do we think about autonomy, how do we think about bias, how do we kind of embed some of these conversations? And I'm actually feel very fortunate that we've started the conversation around diversity, equity, and inclusion. We've had some of these conversations already happening in organizations, but I think that we have to bring as many people to the table to have conversations about ethics. And because if we just solve for one thing, if we just think about bias and we take a technical approach, we miss a lot of opportunity in thinking about all of the other pieces of impact that happen across these tools. So I think, again, my answer is everywhere, all the time. We need to be talking about ethics, and we need to be talking about it in a very practical way. So we need to talk about what the tool is doing and not doing, and have the technical conversation, and make sure you have the expertise that can talk about those pieces. but also in understanding that the people working in the technical space are not going to understand, maybe not understand, the social implications, the personal, the patient implications, the operational implications. Healthcare is a business. There's implications on anything that we put out, any product. And so I think if we can start having these conversations and start thinking about it more outside of just privacy and security, which I think is where we have kind of kept this conversation, but if we can think about it as a larger impact and how these products are really going across multiple streams of the work in healthcare today, I think we'd be better for it.
Sounds exciting.
I'm glad that you have that feeling. I'm excited by it, I agree. So what are some ethical situations that you predict are coming? And what can we do about it?
I think our work is very similar in terms of the technology is creating ethical scenarios. And I think that as we advance technologically, we're going to be able to do more, but kind of the phrasing in ethics, medical ethics, is just because we can, does that mean we should? I read something recently, I don't know if this is true, but I like it and it sounds true, so I'm gonna believe it. If you broke your leg 10,000 years ago, you had the same odds of survivability as if you broke your leg 100 years ago. That we didn't have antibiotics, we didn't really have good surgery, so if you broke your leg in 1901, your odds of surviving were the same as if you broke your leg in caveman times. But now, what's a broken leg? It's almost essentially nothing. What's technology going to be like in the future? We started this by saying ethics really came about because of the ventilator. Before we could put patients on the ventilator, we didn't have these questions. The Seattle God Committee was in Seattle, Swedish hospital. They developed the ability to do dialysis. They developed a long-term catheter. This was in 1967, I believe. And they said, okay, we have 17 spots for dialysis in the world. Who gets those? And they created a committee. They created a group of people who looked at patients, determined their social worth, and said, this person gets it, this person doesn't. Where are we going to be in the future? What is medicine going to look like? When you think about what medicine looked like in 1950, 1970, today, what's medicine in 2050 going to look like? What's medicine going to look like in 2070? We're going to be able to do so many things. And I think some of the big ones that are coming are, I think artificial wombs is the number one thing I think is coming. We're talking about premature babies in the NICU. We're reaching about a limit with 22 weeks, 21 weeks, somewhere in there. We've always said it. I like to read old medical ethics, and something I read said 29 weeks is the absolute limit. We'll never be able to go below that, but that was written in the 1970s, so times have changed. I do think that 22 weeks, 21 weeks is probably the limit because of lung development, but what they're arguing is we're just going to have transplants from natural womb to artificial womb. And the big question that I have about that is, if it's safer for mom and baby, do you now have a moral obligation to use artificial wombs? If you can minimize the risks to both patients, shouldn't you recommend it as a medical provider? Shouldn't you say, this is how we think that should happen? Mix in designer babies and genetic engineering. Are we going to pick hair color, eye color, skin color, intelligence, grow that child in a petri dish, transplant to an artificial womb, and then grow that child? I think that's what's coming. Mixing with genetic engineering. I don't know what that's going to look like. It's scary. It makes me nervous, but I do believe that, actually my colleague Terry Roselle, I've been talking about this for a couple weeks, he sent me an article that said, artificial wombs are here. They're doing it. A news article just got published saying they're doing this with some species, which means it is not that far away. And I think that's going to open up a lot of ethical questions. Just because we can, does that mean we should? What's that going to look like? So that's one thing that I think is coming. Another one that I think is coming is when I was at University of Pittsburgh, we were approved for what was called suspended animation surgeries. I will try to explain this in my philosopher way, which is I have no idea how this works, but apparently patient is in trauma, we'll say multiple gunshots. We cool their body, stop their heart, take away their blood, replace their blood with a substance that I don't really understand, perform surgery on them in that state, recycle their blood, restart their heart, raise their body temperature, and bring them back. We are essentially killing patients, doing surgery on a dead patient, and then bringing them back to life. And we came to work one day and it was, UPMC Presby and Johns Hopkins are approved to do this today. Go ahead. It wasn't, this is theoretical. This could happen. And there's good evidence to show that that might be how we do surgery going forward. If we can get that to be seamless, it takes away a lot of the risks of surgery. So why wouldn't we do it that way? So I think that these are the coming technologies, these are the coming situations. But I also feel that if I give these examples, everyone is kind of wiggy about it. It makes you feel kind of uncomfortable. Go back to the 1920s and tell people that we can do organ transplants. Talk about, show someone in the 1920s a modern day NICU or a modern day ICU. Oh, we have them on 4 pressors, we have them on the vent, we have them on dialysis. That would be just as science fiction as artificial wombs, as suspended animation surgery is to us now. It's going to come, it's going to happen, and we're going to not think about it. But the question then becomes, should we be thinking about it? What are those ethical questions that are going to come up? And should we have people, a part of the medical teams, that are able to address some of these questions that come up?
Yeah. I am so glad we talked to you after you had lunch. I mean, we have just had some pretty gruesome things. But no, I appreciate it. I have it's all visual. I can totally see it. So yeah, that's great. Thank you.
Anything else that you want to, any others? If I have you already queasy?
You can literally do this all day, so.
It's my job.
Yeah. All right.
So I think we'll try to wrap up a little. Where do you think the future is, and how do you think the center can help support that future? And also, are you optimistic about the future, or are you pessimistic about the future?
Ooh, what a loaded question. I'll address that last. So I think, I am right there with you on the advances of technology, artificial womb, those kinds of things are definitely on, our radar as well. I think that we are thinking about how to actually create, these new opportunities and save lives at the same time. But as we know, there's a lot of other things that are a part of that complex conversation. So I spoke to a few of them earlier, but I am excited for the things that we can do around diagnostics. I think it's very, very challenging to use our own human insights and experience and expertise to solve some really complex clinical decisions. We have some really, really great healthcare providers and organizations, but I think that we do have an opportunity to use data and to use technology to help with that. And so I'm really excited for some things that are coming in diagnostics. I also think that there's more things that are being developed to sort of do some cross integration of a lot of technology. So I'm really excited for how are we thinking about how people need to use multiple devices. So a lot of people, especially over the age of 65, have a lot of supportive technology in their body and also use technology to get the healthcare that they need and to monitor their health. There's a lot of organizations and developers that are trying to figure out how those things can work better together to give better insights and to keep people healthier longer. So I'm excited about those things. I think that we can also really use AI in resource allocation. I think we really learned through the COVID pandemic that we have a lot of opportunity to think about how we can redesign our healthcare system. And I think actually technology can give us some insights on how we might do that. With the caveat, though, that we have not seen success with a lot of those AI tools because they actually mirror the biases that we already make in regards to decisions inside of the healthcare system. So we have already been making pretty biased decisions about who gets a bed, who gets a service, how much they get, and all of the other things that come in between in getting a healthcare service. So we don't want to perpetuate that, but I think there's opportunity to think about how we can use these tools with that. So I think that the other part of your question was how can the center help, right? Okay, with everything everywhere. And I was just going to make that my theme here. But I think Ryan spoke to it in his work, and I think we actually have a lot of the same philosophy, ideology, practice, approaches, and how we engage the community in some of these complex conversations. So I'd like to just continue to do that work with healthcare organizations and with people that are developing for healthcare. So with our work specifically, we don't just work with people that are providing care. We also work with people that make decisions about that care being provided, but also there's a lot of other people around and organizations around healthcare organizations that are developing for those organizations. So I'm really interested in continuing to create opportunities to bring those folks together and for us to facilitate a lot of those ethical conversations, to kind of get into the weeds around what are you doing today, what types of tools do you have in your organization, what do you want to do differently, kind of how can we help you with creating new policy, and then how can we help you in implementing some of these improvements. People are already starting to create value statements around how they value technology, but some of the things that their patients can expect. So we're helping to craft those. So I think we have a really great opportunity to continue to work with organizations on thinking about this end-to-end process of thinking about technology and how it's being used in their organizations. Optimism, pessimism, I don't know. I'm probably somewhere in between depending on what I wake up and read that day of what's happening in our world. But I think that there's, I'm definitely not an early adopter of technology, but I think that technology has a really great place, especially for people that need it for everyday life. And so I'm really optimistic about how we can do that. So I'll leave it there. Yeah. All right, last question, Ryan. So how can the center help providers or healthcare organizations kind of address the challenges that you brought up today?
One thing that's always interested me is as things change, a lot of things stay the same. If you read a lot of ancient Greek literature, reread the Iliad, the things that they were concerned about 4,000 years ago are the same things that we're concerned about now. Family, honor, supporting other people. And I think medicine is going to continue to change, but the human nature of medicine is always going to remain there. They are the healing arts. And I think as we think about the technology and what we can do, I think that is a very limited view of what being a healthcare provider, healthcare physician actually is. Being able to sit with a patient who's dying and help support them, being able to sit with a family and be in that room and give them that emotional support, to tell a family it's okay, that there's nothing more that we can do. We have pushed medicine forward so far, and we have to realize the advances are incredible, but there's more to being a caregiver than just doing medicine. It's caring for each other. So what can the center really do as these new technologies come about, as these new advances happen? We can be a part of that team that really stress, how is this impacting the person that we're going to deliver this to? How is the human aspect of this being listened to, being heard, where it's easy to just do, but it's not always easy to step back. When I learned how to do medical ethics, The person who taught me how to do it always phrased it as taking the butt out of healthcare. And the way he said was, when we talk to patients, we always tell them what they know, and then we tell them what we can do. So if you have a new cancer diagnosis, we would say, I know this could be really scary, but don't worry, we have an amazing oncology unit. Our doctors are the best in the world, and we're going to be there and help fight this. Now what does that patient think? They feel pressured. They think that's what they're going to do. He said, tell them the emotion and then stop talking. Don't say but. So say, I know this can be really scary. And then see what the person says. Give them that opportunity to speak. And having ethics part of the team, I think it's going to become a new specialty as much as we have chaplains, respiratory therapists, doctors, nurses, social workers. Medicine is huge, and we have interdisciplinary rounds. We have so many different specialties. I think ethics is going to be there because we're recognizing that we are moving forward so fast. But just because we can doesn't necessarily mean that we should. And they need to have somebody on that team who says, have you thought about it like this? Have you considered it from this perspective? Have you thought what mom is going through right now? I can remember a very powerful story. We had a patient, she was 4 years old. She had a birth injury. She was dying. Mom came back to the hospital to palliative medicine, have her have a natural passing. But mom was actively suing our hospital for the birth injury from 4 years ago. So everybody in the room is uncomfortable, and our pediatric geneticist told us that this may not be a birth injury. This actually might be a genetic condition. We asked mom, can we do a genetic test? Because then we can do some alleviation. She was having really bad neurostorming. Can we do this? And she said yes. And then a couple hours later, she said, I spoke with our attorneys, and the attorneys are recommending us not, so we're going to say no. So now it's everyone's up in arms. Everyone's angry. And I was a part of the team, and I said, well, let's think about it from her perspective. If this was a birth injury, whose fault is it? And they said, well, that would be ours. If this is a genetic condition, whose fault is it? It would be hers. So she's watched her daughter in pain and suffering for all these years. Maybe she doesn't want that guilt. Maybe she doesn't want that happening to her. Also, she's at our hospital. Obviously, she doesn't think that we're that terrible of physicians. So maybe she has 4 other kids. Her husband left her because of the stress of the situation of her dying child. She's had to quit work. Maybe this is resources. Maybe somebody said to her, if you go for malpractice, you can maybe get some resources. Also, how much money would she get if she wins? Not that much. We just had a patient who was in the ICU for over 500 days. The final bill was like $20 million, and we just wrote it off. So think about it from that person's perspective. And when we thought like that, we were able to talk to her better. We were able to support her better, and we were able to actually still be able to deliver that care that we felt was important because we had a member of the team that wasn't thinking about it in the same way that we always think. I love my work, and one of the aspects is I'm on a lot of different committees that I don't feel like I belong on. But I get invited onto them because I'm told you think differently than everyone else. You see things from a different perspective. You bring in a lot of different ideas that are not normal for medical providers to be considering. I want that part of our team because I think that that is a valuable way of seeing the world. So what can the center do? We can continue to partner with more organizations. We can continue to sit down with more providers and provide the moral support that it can be. We can be in more areas that people don't necessarily think an ethicist needs to be involved in. But then when we're there, we do help support the teams and we provide that work, and we are never asked to leave. We're always asked for be there for more situations. And we can be in more patient rooms. We can be there in more hospitals, and we can actually meaningfully touch and impact more people. And that is what I'm hoping for with the center.